Hey everyone, today you're going to meet this really cool dog named Lola. She's a chocolate Newfoundland and she is suffering from an ear hematoma. It's also called an oral hematoma. Ear hematomas are often caused by ear infections, and ear infections are often caused by food or environmental allergies, especially food allergies. That biome imbalance, so the bacterial imbalance and yeast imbalance, and also too many carbohydrates or sugars in the diet. And so this can just be kibble-fed diet, vegan diets, getting too much bread, getting too many treats that have unhealthy sugar-like ingredients, like vegetable glycerin and molasses, and swimming and water in the ears can cause a yeast infection. Luckily, there's a lot we can do to help prevent these infections. We can feed a raw or homemade diet without carbohydrates and changing the protein once a month. We can avoid dairy, grains, kibble, and stick to single protein treats. We can add 1 teaspoon of apple cider vinegar per 30 or 40 pounds of body weight daily. We can add 1 teaspoon of chopped oregano leaf per 40 pounds of body weight twice daily. If the body's in balance, there will be little need for cleaning the ears, and you will get no more yeast infections, no more ear infections. And it's only called oral, A-U-R-A-L, is because that's describing the part of the ear between the inner and the outer flap that's filled with blood when there's trauma. So normally there's 3 causes of ear hematomas in cats and dogs. And one is an ear infection. That's the most common cause by far. A nice yeast infection and the dog or the cat shaking his head or scratching at the ear excessively. But if a dog gets wet and gets an ear infection, like so we're swimming, then they can shake their head and get an ear hematoma. But in this case, Lola got one from her puppy friend who bit her ear. So it's just trauma to that part of the ear. But I want to tell you guys, there's a non-surgical way, but also I looked on the internet and everyone's using like needles and bleeding and it sounds like medieval times. But this is a non-surgical way that doesn't involve medieval devices. And it just involves massaging food-grade castor oil, similar to this product, just 2 or 3 drops, massaging it into the hematoma. So usually on the inner surface of the hematoma, so we can get good skin contact. And if you do that every day, twice a day, it'll disappear. But what it does is, it sometimes takes up to 2 weeks to work though. So you also have to treat the underlying infection if there is one. Otherwise the dog's going to keep shaking his head. And here's what it looks like when a cat has had an ear infection too long and shook his head and has an ear hematoma or oral hematoma. And this is what it looks like when a cat has cauliflower ears or had multiple hematomas, multiple surgeries because of multiple ear infections.
Hot chocolate for you.
Okay, this is Lola. Isn't she beautiful? Yeah. This is the normal ear. See everybody? Normal. See? Beautiful. Let's make sure it is normal.
It is.
Okay. Now normally these hematomas are caused by ear infections. Can I get to it from the top?
Let's see.
Let's turn on the light better. Whoops. That didn't work.
There we go.
Okay, here's the hematoma on this side. Let's see, Sarah. Oh yeah.
You can just see how it moves there. Yeah.
So this is all filled up with blood right here. You guys see that? Blood. Now normally there's an ear infection. Yeah, and normally they shake their head.
Yeah.
She hasn't been shaking her head though.
No, she has not.
So this one was caused by another dog. Would you say that?
Yes,
Okay.
that's totally fine.
You see that that's not flat? Yeah.
Yeah.
So what we're gonna do, whoops,
Here she goes. Oh, thanks, Lo.
is we are going to massage food grade castor oil into it. Oh yeah, you can see it now.
Yeah.
And so that way we can avoid surgery. Food grade castor oil, we're gonna massage it twice a day, every day. Sometimes it takes 5 days to go away. Sometimes it takes 2 weeks to go away. And we're gonna just stay with that program. It's gonna be massaging it
into this part of the ear canal, into the on the skin side. She's being silly.
So all this talk about preventing food allergies and ear infections and changing the diet from a kibble, say that you might buy at your veterinarian's office, to something different leads us to another point, and that is that, we have this condition called DCM. It's a heart condition, and it's very serious, and there are potentially some nutritional causes of it, and there's some genetic causes of it. But what I wanted to do here was just give you a little slide saying we need to do more research about the subject in general, but a well-balanced raw diet can have more bioavailable taurine than kibble diets. The key is to learn how to balance the diet. So I wrote a whole chapter on my newest book, Zen and the Art of Caring for Pets. You can buy that on Amazon. Give me a review, that'd be great. And this chapter really goes into depth on the bioavailability of taurine and DCM in general, and the research that's coming out now, so you might want to take a look at it. And also, stay tuned for another podcast and YouTube video on the subject of DCM. It's really important, and I want to get all the information out to you guys. And you can comment here if you have any other thoughts. Thanks.
So anyway, that concludes our video. I hope you enjoyed it a lot, and Lola's doing great today. Her hematoma cleared up, and I want you guys to spread the word that there's great ways to prevent ear infections and help your dog's allergies before they even get an infection, and spread the word. Subscribe to the YouTube channel and listen to my podcast on Apple and Spotify. Thanks so much, guys.